Rijhwani. I have been a physical therapist for over 10 years, and I've practiced in the states of New York and Virginia. And after my physical therapy school, I took the first McKenzie Part A course. And, I heard about the research, about the system, and I saw them treat live patients on the stage. And I had never seen something like that before in my entire physical therapy school. Mind you, I was a licensed provider practicing at that time already. And then I went back to the clinic. I started practicing it on my patients. And, I saw the results, and that was it. Then I started following through the series and kind of went on with the whole journey, finished my certification, then finished with the diploma program, and here we are. Okay, so I have been using telehealth in my practice for a long time. I started seeing patients via telehealth in January of 2018. And the reason we started it at that time was I saw a huge need for it because there weren't enough McKenzie trained practitioners in my area. Well, there weren't any at all. So there was a big need for people within my state to have access, to those providers. And I also felt like, we are moving towards the digital age and everything is moving towards online. So it's important to have some sort of online platform as well. Put systems into place as to how we'll treat these patients, how we're going to get the paperwork filled out, how we're going to get the payments. And the demand has definitely increased significantly since the whole coronavirus situation. So before, telehealth was mainly utilized by people who weren't living close to our practice but still wanted to work with us. But now it's like almost everyone prefers a telehealth session in the last few weeks over coming into the office. Yes, absolutely. So, the MDT form of assessment and treatment is like you perfectly suited for telehealth. We do not rely on, things like palpation and looking at trigger points. In fact, we look at a movement exam and then we look at a repeated movement exam, and most of this can be effectively done through telehealth. So MDT is kind of perfectly suited for, this medium of care delivery. It makes a huge difference. So initially, everyone has a little bit of hesitancy of switching over to telehealth because they don't see the value. They don't see how you can kind of deliver them the same outcomes via video. They just can't envision of how it's going to run through. But once they've gone through a session or two, they start to feel more and more comfortable. And once they start to see that they can get the same outcomes, the same results through a telehealth session as they would get in the clinic, then, they are kind of all bought over. So the common response we get is surprise. I cannot believe that you can do all this through video. And of course, they are happy and excited to get the outcomes too. So we don't do it much differently than we would do it in an in-person. They have a scheduled appointment time for a telehealth visit, just like they would get for an in-person clinic. They get the reminders and they have the one-on-one session with the therapist or the McKenzie method provider. And then we follow the session up by sending them videos of the exercise or the movement that they've been asked to do at home. And we are always in touch with them via emails. And then there's a next appointment set up a few days after or the following week. And based on that communication, most of the patients, I think sending them the videos for the follow-up makes a huge difference because they know exactly what to do, which they tend to forget sometimes when we talk through on the session. Yeah, initial hesitancy is always, I think that's the biggest barrier to telehealth. The patients not having the buy-in, they're not seeing the value of a telehealth visit being the same as an in-person visit. It's definitely changed a little bit because of the pandemic. I think the safety has kind of taken that away a little bit, but it's still there. And the way we deal with it is we talk to patients and keep them focused on the outcomes, and not the process. Like, we don't talk about the hands-on therapy or what is going to happen during the session, but we keep them focused on the outcomes. Like, for example, we'll keep them focused on what we can do for their back problem, and not focus on the hands-on therapy part or the modalities part and things like that. So that makes a huge difference. And then another big game changer for us has been getting social proof. So people who have benefited from telehealth sessions, getting reviews from them, either written or on video, and talking about how they were initially hesitant about telehealth first, then they did it with us, and how things are now gets a lot of people over the line as well. So it's on our website, it's on our YouTube channel, social media, and then we'll even like send it to someone who's on the fence about it and be like, I'm not sure if I want to do it. Then we'll just send them the video just in case. Well, first of all, I feel as MDT trained providers, we are uniquely qualified to be on the forefront of delivering telehealth services, and there is a need for it now more than ever. And then, like I said, with the MDT assessment and treatment, we are uniquely trained to look at like the quality and quantity of motion, the repeated movement exam. We market ourselves as movement experts. So through telehealth, we get that perfect platform to show our value as a mechanical therapist or a movement expert, and kind of being on the forefront of it instead of like shying away from it at this time is really the need. Like, we need to kind of lead the road, if you will, with the telehealth forefront. And if there are any MDT providers who are not practicing it, now's the time to study the legalities, understand what the laws are in your state, in your country. And once you've got all that sorted out, you can start talking to your patients and kind of step by step transition them to the telehealth world. And what has helped us is making it easy for our patients. Like, the easier we can make it for them, the easier they are to transition over, offering them any tech help or anything like that to just make that transition smooth for them. Because some of them might be hesitant because of the technology. They might think it's going to be something very complicated, but it's just really clicking on a Zoom link and they are with you.